We are very happy to have such a wonderful faculty, Dr. NIKUNJ Trivedi from UK, joining the session, and he is a regular presenter in this forum. He has presented so many sessions in this forum with beautiful slides, and all the PPT were really excellent, and all the cases he has shown were really amazing, I want to say. And let me introduce our respected Dr. Nikunj M. Trivedi sir to this forum. As you all know, Doctor is a practicing specialist in used to practice infertility as a specialization, and he has done a wonderful job in that area. Not only in that area, he is an expert in treating chronic diseases, and he has been there from the very beginning in the International Forum for Promoting Homeopathy, to promote homeopathy, to educate the junior doctors, as well as doing wonderful job in UK. He has been in India from 1980, and there was a clinic in Gujarat, Delhi, and everywhere. And now from 2008 onwards, Dr. shifted to, from 2004 to Doctor is practicing at UK at RT Clinic with his wife, and both are doing excellent job there. And Doctor has won a lot of awards from many organizations. He is an active member in HMAI and other homeopathic associations, and really a thrilling personality with knowledge. He is a person who never compromise investigations, and he always advise persons to do all kind of investigations to know what is what and what is there in a patient, and always find out each and every symptom from the patient, and then the sir used to find the best rubric to choose the right remedy, and is the person who has presented almost all areas of treatment in this forum. And today, sir will be discussing about the most important, one of the most important area, that is renal diseases. And the management of renal diseases with homeopathy is something great. I hope all of you are awaiting for the session. And let us welcome our respected Dr. Nikunj M. Trivedi to this forum. Welcome, sir.
Thank you. Thank you very much, Dr. Ganesh.
Sir.
I can see Anjana as well over here. Yes. When I asked Dr. Ganesh to suggest me any topic which can make a sort of interest to all our practicing homeopath, he suggested on renal disorder. Considering his request, I respect him a lot. So considering his respect, today I'm going to present on renal disorders and homeopathy. And here I would like to take a permission to share my screen.
Yes, sir. You are the host, so you can do that. Yes, it's coming.
Okay, coming?
Yes, sir. Yes, sir. Yes, it's fine, sir.
Okay, so today we are going to discuss very interesting statistics I found, not with the UK, but I did some research on Kerala state as well. And today I'm going to our master, Dr. Hahnemann, has taught us, dare to be wise. Ode sapere. So just following his footsteps, I am always insisting on clinical side of homeopathy, that how homeopathy do a magic if you go on aspect. And once you go on clinical aspect, you will never fail to give the result. So I would like to share a surprising fact about renal disorder. More than 1.8 million people in England. I'm talking about the England. I'm not talking about the UK. I'm talking about the England. More than 1.8 million people in England have diagnosed with the chronic kidney diseases. In short, we call the CKD. 3 million people already have renal disease in United Kingdom. United Kingdom is made up of 4 countries: England, Wales, Northern Ireland, and Scotland. So if we consider all these 4 areas, 4 countries, then 3 million people have already been diagnosed with the renal disorder, and most of the kidney diseases are caused by the and in addition to it, there are thought to be around 1 million people they have not been diagnosed. They are in a latent stage. They have not been diagnosed with the renal condition. Renal disorder can be substantially reduce the quality of life and leads to premature death for thousands of people each year. If we go in a pathophysiology of kidneys and renal disease, when we are comparing, then kidney is the vital organ to remove the toxin in the form of excretion from our body. But when kidney fails to do its job to remove the toxins from the body, and when the body retains that toxin, it can lead to a serious side effect, serious condition, and it also invites lots and lots of serious comorbidities. So as I explained you that 1 million people are still undiagnosed in UK. Now we are coming to the statistics. Kidney diseases is a growing concern in Kerala, in India. There is one government body called the Mrita Sanjeevani. Mrita Sanjeevani has done the research and they found that about 2.5 lakhs kidney patients in Kerala. Most of the kidney diseases are caused by the hypertension and diabetes, which affects 75% of kidney disease in Kerala. In Kerala, 1 out of 5 people are affected by diabetes, and 1 out of 3 people above the age of 19 years have hypertension. And this is really eye-opening problem for the Kerala state. Here also, there are lots and lots of things which is being played to invite the kidney disorders. So now, let us understand the surprising fact about the renal disorder. About more than 1 lakh dialysis are conducted in the state of Kerala. And the number of dialysis centers increased 6 times more than within 5 years. So we can come to know that kidney diseases are prevalent everywhere, not only in India, not only in UK, but it has been spreading like anything. And for that, we have, as a homeopath, we can prevent certain conditions. So with that, the aggravation of the kidney conditions come under control. So now let us understand the function of the kidney. What kidneys? So kidney is regulating of the water content of our body. It is also regulating our electrolyte balance. So to maintain the electrolyte balance, kidney is playing a vital role just to maintain the sodium, potassium, chloride, and everything. And we come across about any results of the patient, then the electrolytes, we are giving a more and more importance just to assess the kidney function. Third function is maintenance of normal acid-base equilibrium of blood. Acidosis, ketosis, uremia, these are the outcome of the long-term sufferings, and kidney is just maintaining the normal acid-base equilibrium of our blood. The fourth function is the retention of vital substance to the body economy, like glucose, amino acids, phosphate, bicarbonate, protein, etc. When kidney having a cortex and medulla, as you know very well, when the cortex is affected, medulla is affected, patients start losing the protein, and we call the proteinuria, and we call the albuminuria as well. So this retention of the vital substance is very, very important. Okay. Now, excretion of waste metabolic products, toxic substance and drugs. And today we are going to discuss about certain drugs which can harm the kidney and how it can harm. And last function, hormonal and metabolic function. Kidney is maintaining the metabolic function and hormonal function as well. So any impairment in above function results in renal disorder. I had one patient, young lady having a very high blood pressure. She was from the Delhi, and she was diagnosed with an incurable condition, and that condition is called the Cohn's, C-O-N-N-S, apostrophe S, Cohn's syndrome, where the adrenaline secretion goes so high, and that's why that lady had a high blood pressure, which was not coming under the control, and I treated that patient very nicely. If you want to read this case, it is available on my website. So last function, the hormonal and metabolic functions are very, very important to understand. And as I mentioned that any impairment in all above normal function, normal kidney function, normal renal function results in the renal disorder. So today's discussion, we are going to discuss about drugs-induced renal disorder. And we call it nephrotoxic factors, and its homeopathic management. Nephrotoxic, a substance which is toxic to the nephron, a substance which is toxic to the kidney. When kidney is not able to eliminate that metabolites of the drugs, then it is damaging kidney. Already patient having an infection, on top of that patient is taking medicine of blood pressure, medicine for the thyroid, medicine for the diabetes, other antibiotics. Sometimes patients are very enthusiastic to take supplements just to keep them fit, but damage to the kidney. That's what we are going to see today. So our master, Dr. Hahnemann, has described the concept of individualization. We learn and know about idiosyncrasy in organ of medicine from the year first. Similarly, the kidney also got the susceptibility. Kidney also got a susceptibility to the drugs, susceptibility to food, susceptibility to the environmental factors, everything. So as we are sensitive, as we having idiosyncrasy, as we having a hypersensitivity, so kidney is a part of our body, and kidney also got the same type of sensitivity, susceptibility, and idiosyncrasy. And we call this thing as a idiosyncrasy of the kidney. And how nephrotoxic factors as affecting the kidney is very, very important. Our kidneys are also sensitive, susceptible with the lifestyle, with the food, with the drugs, with the water intake, and with the associated latent myasm, SORA, syphilis, psychosis, tuberculosis. All the myasm is also playing a vital role on kidney function, in renal function. So let us take an example of water intake. We are taking water every day. It's a part of our food, diet, our lifestyle. Without water, no one can live. So long back, when I was practicing in India, at that time, I was getting many patients having a headache. Every 3-4 patients in a day, they were complaining of the headaches. When I used to check the blood pressure was a bit high in a younger patient. In a mid-30 to mid-40. Then I was surprised that why patients are complaining of the headaches. The reason was that there was one article published in a newspaper that if you drink 5 glasses of water on empty stomach in the morning, it will help you to keep you healthy. And this was the factor. Patients were taking 5 to 6 glasses of water on empty stomach. That was making to rise their blood pressure, and ultimately that condition has been diagnosed as a water intoxication syndrome. So they were overloading their kidneys. And when the water has not been excreted out, patients were feeling headaches, heaviness of the head, and many of them, they have landed up with a high blood pressure. So sometimes too much precaution is too dangerous. And sometimes these supplements, those are fond of keeping themselves fit, healthy. They are taking a lot of supplements without seeking any medical advice. Like some people they are taking the zinc, magnesium, then multivitamin tablets, essential amino tablets, evening primrose oil, and everything. I come across such type of patients every day. I advise them that before you take anything, just take a medical advice to any qualified medical practitioner. So by that way, you will not end up with any serious kidney problem. So this all about taking a precautions for our kidneys. Kidneys are very vital and very important organ. And what are the nephrotoxic factors? Analgesic. If anybody having a headache, straight away they take paracetamol. In India, people are fond of taking painkillers like diclofenac sodium and paracetamol combination. During COVID time, I have seen that loads and loads of patients, they used to take Dolo. I don't know what that tablet is, but I came to know a lot of patients, they were talking about taking a Dolo. I think this paracetamol and diclofenac sodium, that combination is very much prevalent in India. Piroxicam, indomethacin, oxyfenbutazone, phenylbutazone, all these painkillers, it is nephrotoxic. Non-steroidal anti-inflammatory drugs, antibiotics and antiviral drugs, antihypertensive blood pressure medications like ACEI, angiotensin converting enzyme inhibitors, and ERB, angiotensin receptor blockers. If it has been taken for a prolonged period of time for the chronic condition of blood pressure, then it might damage the kidney. And that's why patient of blood pressure is developing a kidney problem later. Proton pump inhibitors, and to control the hyperacidity, like lansoprazole, pantoprazole, like medicine. Herbal supplements, they are very rich in heavy metals like gold, silver, copper, etc. You must have come across Ayurvedic medicine, which is containing Suvarna Bhasma, Tamra Bhasma, in a Chawanprash. The patient, those who are having a hypersensitivity to it, chances are damaging of kidneys are very, very, very high. I was come across one patient, even my earlier webinar also, I discussed this thing that one young lady having a menstrual disorder, and she was being prescribed to take certain Ayurvedic medicine, and she took it, and ultimately she landed with bone marrow depression. She had a profuse bleeding and she passed away because of the heavy metals. Kidney was not able to excrete out that metal from the body, and ultimately she developed a bone marrow depression, bone marrow suppression, and she passed away. Now, psychiatric medicines like fluoxetine. Here it is available in a brand name of Prozac, and it has been said that in England people are using more Prozac than paracetamol because people having a lot of mental issues, mental problems, stress, tension, anxiety, apprehension, anticipation. So just to get rid of all this problem, they take Prozac. Sometimes when patient goes to the general practitioner with the same complaint again and again, so general practitioners are prescribing amitriptyline. Amitriptyline is considered to be the pain reliever, but it's antidepressant. Lithium carbonate, patient having a schizophrenia, they are under psychological observation, and when they're having a severe episode at that time, they have been prescribed lithium carbonate. Immunosuppressant and immunomodulator, steroids, and statin, high cholesterol. Many patients after 40, 45, here regular we having a blood checks. And when we found, when the GP found that the patient having a cholesterol, high cholesterol, then they are being prescribed the statin, atorvastatin. And that atorvastatin, if has been taken for a longer period of time, it is also damaging the kidney. And last, anti-hypoglycemic agent like metformin, linagliptin. See, majority of the diabetic patient is a renal problem. In my practice, I have seen that any patient who gets diabetes, after a couple of years, they are coming with some kidney issue. And it has to be addressed in such a way that kidney function can improve and diabetes should not get worse. So we have talked about nephrotoxic factor. These are the nephrotoxic factor. So when you come across any patient having a prescription medicine, like all that what I have discussed right now, just be careful about the kidney function and just monitor very closely. Other factors, laxative, oral sodium phosphate causing blood mineral disturbance. And one of the main function of the kidney is to maintain the blood mineral regulation. So any patient having a long-standing use of OSP, oral sodium phosphate containing liquid, which is widely used in colonoscopy to clean the colon before they perform the investigative procedure of colonoscopy. And some patients, they take oral sodium phosphate laxative. This is also causing a harm to the kidney unless and until it has been completely exited out from the system. Now coming to the contrast dyes. And these contrast dyes are widely used in computerized tomography and angiogram, causing SIN, contrast-induced nephropathy, and NSF, nephrogenic systemic fibrosis. Kidney gets fibrosed. Why? Because of the idiosyncrasy, because of the hypersensitivity, because of the overreacting issue with this dye, with this contrast. And as you know that recreational drugs like heroin, cocaine, ecstasy, etc., it is also damaging the kidney. Alcohol is also damaging the kidney. One of a prominent figure in homeopathic world in England, he was on dialysis. He asked me that, can you please help me by suggesting some medicine? Because he has to do the peritoneal dialysis every other day at home. And looking to his condition, I asked the history, and he was taking every day alcohol. So I told him that first you have to stop the alcohol. Then and then I can prescribe you the remedy. And sadly, he passed away. So alcohol is one of the factors to damage the kidney. And lastly, the existing comorbidity which can damage the kidney and which are also a nephrotoxic factor because of the anti-hypoglycemic and anti-hypertensive medicine patient is taking. And any patient with a history of cardiac involvement or history of stroke and those who are on long-term medications, to correct it, then it can also damage the kidney at later stage. If it is not damaging, but their kidney becomes very, very sensitive, they are vulnerable to catch any sort of infection at any time if any drastic change happens in their lifestyle. Okay? Other factors which we come across in our day-to-day routine life. Overuse of salt. Salt is very tasty. When we eat crisp, we finish the crisp in one go. Sugary things, chocolates, ice cream, cake, pastry. Overuse can invite the hyperglycemia. Salt invite the hypernatremia. Fast food, junk food, processed food, tin food, and contaminated food. They are also a responsible factor for damaging the kidney, and they are also considered to be a nephrotoxic factor at some point. Poor hygiene inviting recurrent infection. That infection causing a short of a burning in urine. Burning in urine needs a shot of antibiotics, and that antibiotics is also causing a short of damage to the kidney. And disability. Patient wearing a diaper, patient wearing a nappy, patient having a complaint of incontinence, or there is a loss of control over the sphincter. They are developing a retrograde infection. And that retrograde infection is damaging the kidney. And second thing, when they are confined to the bed, their immune system is also functioning very, very low. And that is also one of the factors that patient become vulnerable to catch any sort of infection. So these are all about the factors that what we have discussed. And now coming to very important part of our homeopathic aspect. So considering the root cause of all those factors, it proves and establishes the thought of destructive miasm, and that is syphilitic miasm. And patient having a renal disorder, we should not overlook or forget to look deep into the syphilitic miasm. So what syphilitic miasm having in common? What are the syphilitic urinary symptoms shows? Syphilitic itself is a destructive miasm. Destruction, dissolution, degeneration, and damage. They are the keywords for the syphilitic miasm. With the syphilitic miasm, patient has a diminished flow of urine. Diminished urine flow, frequent desire for micturition, but flow is scanty. Irritation during the flow, recurrent infection, stricture, adhesions, and the syphilitic patient is mentally very stubborn and introvert. These are the common characteristics of the syphilitic miasm that we should keep in our mind when patient comes to us. And if we go on chronology of the renal disorder, then you can find these are the common symptoms. Patient abdominal pain, ammonia swelling breath. If you are taking a blood pressure, then also you can find ammonia smelling breath, or sweat, backache, loin to groin, which is coming from loin and it is going down to the groin. So when you are clinically examining the patient, these are the things which you should keep in your mind. Frequency with burning and color of urine changes. Sometimes you find a complaint of cloudy urine, sometimes it's dark, and sometimes it's bloody, means mixed with the blood. Patient has dysuria, painful micturition, and difficulty in passing urine. Hematuria, blood in urine, foul smell of urine, and incontinence with itching. Patient always complain itching with involvement of the renal disorder. As it's a chronic infection, CKD, chronic kidney disease, patient having a loss of appetite, patient having a pelvic pain and backache, especially in female patient, they are always complaining of the pelvic pain and unexplained tiredness. Patient gets tired very easily, and it's unexplained. That why patient is getting tired, patient cannot explain. But when we examine the patient physically and clinically, when we investigate, then we can come to know that these are the common symptoms which can gives us some idea about the renal disorder. Oh, now let us discuss about a small case of a young boy. This is quite old case for me. This gentleman, he brought his son. At that time, he was 6 years old in 2009. He was not keeping well since he born. And he was a very precious child because they got the result, means the lady conceived at the age of 40, means a very precious child for them. And if something goes wrong with him, they were so scared. So that's why I use a precious child for them, for the elderly parents. So he was not keeping well since he born, crying constantly, precious child of the elderly patient, always complaining of the pain in abdomen. Always, after food, before food, when he was a baby. But when he having some problem, they used to run to the GP. They used to run to the hospital. They used to show the nephrologist and whatnot. Always complaining of pain in abdomen. And when he was brought to my clinic, he was not allowing me to touch his tummy. Very sensitive to touch. He was not allowing me to examine him. He was refusing the food. No appetite. He was refusing everything, even chocolate and ice cream. These are the favorite things for the children, but he was completely refusing it. Very irritable, very cross, demanding, throwing tantrums, and looking to him, the face was red. And that's why I put a question mark: anger or fever? Constant moaning or crying, not loud crying, but constant moaning for small things. I want to go away from the clinic. Please carry me. I don't want to do this. He was just lying on the floor, just throwing his tantrums by uh, making a sort of a weird noises in the clinic, screaming and crying while passing urine. These very important symptoms was given by the mother, that when he complains to go to the loo, to go to the toilet to pass the urine, he was screaming and crying. Nocturnal aggravation with tremendous restlessness. From one end, he goes to the other end. So these are the symptoms that what I got from the patient. With fever with rigors, shivering. They were putting 2 to 3 quilts, but his shivering was not going away. They form a habit. They have a habit to use a regular paracetamol, syrup paracetamol. And he was being prescribed various antibiotics from amoxicillin to the ciprofloxacin. He was given antispasmodic, Buscopan liquid, frequent admission in hospital, and he was given a frequent intravenous antibiotics, at least 5 to 6 times in a year. And with the fever, mother explained that we must put 2 to 3 quilts, blankets, to relieve his chill. That episode was lasting only for half an hour. After giving paracetamol, when he started shivering, they were giving a paracetamol and putting a quilts, but the vigorous shivering was making them to put 2 to 3 quilts. So GP has many times checked his urine. They found urine albumin 3+. Pus cells plenty. Then albumin came to the 2+. But albumin was there. They did a culture and they found a Proteus mirabilis. Culture of Proteus mirabilis. It's a gram-negative anaerobic bacteria. And the colony count was 1 lakh colony forming unit per ml. Means it was a severe infection. So, along with the history taking, I carried out a clinical examination. I wrote it down, everything on a piece of paper. I observed the patient, how patient is behaving, and then I requested parents to help me for the clinical examination. I examined the patient. I took the temperature. I ausculted the patient. And when clinical examination was carried, any guess? Any one of you want to share their thoughts? Any participants would like to give any idea that what it could be? I would really appreciate if anybody write their thoughts, their diagnosis in a chat box. No? Okay. Now let me end that suspense. This is the charm of clinical examination. This is the charm of clinical examination. We must examine our patient. Homeopathy is a wonderful science. I'm not against in history taking on classical way, but simultaneously we must examine the patient. And patient was found with the phimosis. And what is phimosis? So let us understand phimosis. Phimosis is a Greek word. Phimosis means muzzling. Phimosis is a Greek word. It means muzzling. The foreskin of the penis can't stretch to allow it to pulled back on the glands. A balloon-like swelling under the foreskin may occur during urination. It may not occur. Accumulation of smegma brings irritation, and that irritation brings inflammation, and that inflammation results into the infection. And here the vicious circle starts. The patient is going round and round in a merry-go-round. When recurrent infection results into the chronic one, it brings all the complaint what this young boy had. This young boy, again, we are going back to the previous slide. No appetite. Any chronic infection will not bring any appetite. No appetite, child refuses everything. So looking to these symptoms, when I presented this case in so many webinars, so many seminars and conferences. And I was asking that what could be the diagnosis? What could be the outcome? Majority of the homeopaths have suggested me chamomilla. Child refuses everything. Don't go on only on one symptoms. The red face. Yes, it is chamomilla, but here it is not chamomilla. We'll see what it is, right? So fever comes periodically, fever with rigors, regular use of paracetamol, antibiotics, intravenous antibiotics, and everything was given. Culture has shown the Proteus mirabilis, a gram-negative bacteria. And along with history taking, the clinical examination has made me to find this phimosis. And now I explained that what is phimosis. It's a muzzling. When we are putting a shot of a muzzle on the mouth of a dog, you must have seen. So that's called the muzzling. The foreskin of the penis can't stretch. And considering the history, physical examination, repertorization, and comparing symptomatology with the rubrics, selection was made. And you can see phimosis has caused chronic pyelonephritis, recurrent infection, water retention, swelling all over the body because patient had an anasarca. Patient was blue up like anything. Patient had albuminuria, presence of pus in the urine, albumin plus. When he came to me, previously it was 3+. But when he was brought to me at that time, albumin was 2+. Pus cells plenty, culture was showing the gram negative, and colony count was 1,100,000 colony forming unit per ml of urine. So it was an advanced case of genitourinary system. So then I did a comparison with the boric, with the synthesis, and I did repertorization as well. So in boric, it shows the fears to touch, cannot bear pain, whole body oversensitive, pain in stomach during eating, pain in stomach without eating, urine retained, unable to pass, vesicle, tenesmus. Tenesmus means cramps over the bladder with painful micturition, painful urination. Febrile symptoms closely related to the typhoid. Shivering over the body, aggravation from touch, motion, and rest. And what synthesis shows that fear or aversion of being touched, sensitive to pain, oversensitive to pain, you can say defensive, irritable, and obstinate when approaches, restless because of soreness, udder, rotten egg, very bad udder, abdomen tenderness in inguinal region. When I press on different quadrant of abdomen, the right iliac fossa and left iliac fossa was very tender. Must walk bent forward. Urine, retention of urine, male inflammation of the genitalia. And what I concluded with the arnica. Arnica montana. I selected 200 potency internally. 4 pills morning, 4 pills evening. Continuously, I observed the patient and slowly, I told that continue. And externally, I advise patient to take a 50 ml of coconut oil, put 10 drops of arnica mother tincture, mix it thoroughly, very well, and apply locally. We maintain the regular follow-up for 1 month. And after 1 month also, I called the patient. And parents were very keen that you take enough care, because right now my son is not getting any fever. He is not screaming. After 1 month, they complained that no screaming, nothing. Phimosis completely resolved. No phimosis at all. Periodical checkups every month for 1 year. I checked this patient every month for 1 year. Parents were very happy, and they left a kind word of appreciation that you can read here.
Yes. Yes, sir. It's really a wonderful session from you. Really, we enjoyed every part of your presentation.
Thank you. Thank you very much. I don't take your much time because I can see that it's time for your Malayalam session. So I have cut down a few of slides of the culture and other clinical investigations results I have scanned, but I just cut it down because I want to finish it within 1 hour. So just I'm summing up, and thank you very much for all your support, and thanks for listening me.
Yes, sir. We can have a discussion session soon after this. We have 10 more minutes for discussion. And
Okay.
definitely, as you rightly point out, that Kerala is a state which is having only 3.5 crores of people, but the medicine taken by the people here are more than 30% of the whole medicine used by the Indian people. That you can that from that alone you can understand why the renal problems are very high in Kerala. And as you pointed
Because
out,
of the water.
yes, not only that they are not taking the water, but it is always people used to say that it is because of the chronic kidney disease. But how this kidney is being diseased, that is the question to be asked. But when we analyze each and every case, what we find is that usually people used to take a lot of antibiotics as well as even for a single cold, they used to take antibiotic. So abuse of these kind of medicine is the one of the biggest reason for the destruction of kidney diseases, and that may be the reason why the number of kidney diseases are on the rise in Kerala. As when compared to the other part of the India, Kerala is the highest.
Yes, yes.
Because
Kerala having the highest number of kidney patients. Yes,
as you rightly
researched.
as you pointed out earlier, that the number of diabetes, it is not that Kerala is the place where the diabetes is increasing day by day. As you pointed out, just 1 in 5 person is having diabetes or some kind of diseases. And
hypertension is also on top in the Kerala.
Yes, sir. I know that some patients even use 33 tablets a day. So all these tablets are going into the kidney. And definitely that may be
kidney has to filter it.
But still, those people sitting in the other side of the medical profession used to say that it is a chronic kidney disease. But frankly, it is a physician-made disease.
But here I showed this case. The main reason is that we should also examine the patient thoroughly. So sometimes only antibiotics is not helping the patient, because when there is a muzzling, it is not allowing patient to exit out all the toxins from the kidney.
Exactly, sir. Exactly. We here in Kerala, most of the doctors used to examine all these things because most of the patients brings out all kind of test results. They used to go for ECG, EEG, scanning, urinary. Even for a urinary infection, they come up with a culture result. That's what we used to see here in Kerala. I think Sridhar Kurva sir is there to have a chat with you, sir. So also Anjana Jadeja, doctor, also want to have a chat with you. So let us begin the session with Dr. Sridhar Kurva, one of the veteran from Kerala. He was the former assistant director at the Central Council of Homeopathic Research in Kerala. Okay, sir.
He was in our college as well.
Yes.
Sir, that Dr. NIKUNJ Trivedi, I am so happy that you are in this forum, because while you are a student, I was in Anand. That time, 2 persons I cannot forget. One is that Prabhu
Barwalia.
Barwalia, and yours.
He was my junior.
You both were the number 1 students from our Anand Homeopathy College. You are the 2 students, I cannot forget it. So I am very proud about you. When your students are far better than that, you will be proud about that. I am one among that. So I am very proud about you, and even Prabhu also. Prabhu Barwalia also. He was also number 1 in now Bombay. So I am so happy that your session was very interesting and very nice. Come again with a new subject. Very interesting and very good. Have a good thanks, and wish you all the best, and a big salute for you. Thank you from my heart. Okay.
Thanks a lot. Any other question?
Yes, doctor. Now it is up to Dr. Anjana Jadeja to speak. You can have a chat with the Dr. NIKUNJ. Please unmute. Please unmute. Please unmute. If you want to speak, you can unmute. Okay.
Hello,
Okay,
sir.
you're okay.
Yeah, it was very nice session, sir. Thank you very much for inviting me. And I'm always like eagerly waiting for your sessions here. And yesterday also I have attended some doctor from Parod University. That session was also very nice.
Good,
So
good.
you guys are doing very nice work.
Good.
Keep doing. Thank you.
Thanks. Thanks.
And now it is Dr. Muhammad Saidin from Saudi Arabia.
Sir,
Hello.
am I audible, sir?
Yes, yes.
Yeah, I can.
Yeah.
I can.
Thank you. It's that was very interesting case. Thank you very much.
Thank you. Thank you, sir.
The question is, can we isolate some of homeopathic remedies as an antibacterial agent to add
Yes.
to
Yes. Yeah.
to-
Yeah.
to-
See, the homeopathy means similia similibus curantior. Right? That is our principle. Similia similibus curantior. So in UK, we are also getting a medicine prepared from the staphylococcus, and
Yes.
that is called the isopathy. So they are manufacturing the medicine from the disease product. That's not the nozzle, but from the Helios, they are supplying you the same medicine. Say, for example, in this case, the gram-negative bacteria. So there is, but in general, say, for example, it's a very long story to order this medicine. But in my practice, if you understand the basic physiology and basic pathology, like inflammation and infection, any infection, this patient had a symptoms like typhoid. In initial stage, anybody can suspect typhoid. So and I was also thinking about giving a Baptisia to this patient. Baptisia is a homeopathic antibiotic. Baptisia tinctora is a homeopathic antibiotic. Paramphos is a homeopathic paracetamol. If any patient is not getting relieved with the fever, and if you give paras sulfate, then paramphos regularly, every hourly, every 2 hourly, then patient drop the fever very immediately. Belladonna simultaneously also helping to reduce the inflammation. So yes, you can use Baptisia as a general antibiotic in a form of homeopathic antibiotics.
Okay, sir. Thank you very much. And now it is up to Dr. Harikaran. He was the former Chief Medical Officer at Government Service Kerala, and he's a wonderful, very good person who is having very high knowledge in homeopathy. Welcome, sir. You can say a lot of thanks to this.
Hello, sir.
Okay, thank you, sir. Very nice class, very informative regarding kidney diseases. And I like to ask, sir, apart from your class, see, have you attended, you met with, vesico-ureteral reflex case?
Sorry,
Attended you vesico-ureteral reflex case.
Vesico-ureteral reflex.
Reflex.
Okay, so we have to break that. We have to break that reflex. We have to break that reflex.
Okay.
Yeah, and there are medicine like causticum that can break that reflex.
You have you got any experience regarding that?
Oh, sir, I have seen a lot of patients here. Also, I'm getting a lot of patients with this kidney problem. Actually, basically, my specialization is infertility. But here I'm getting all the various type of chronic patients, and I'm working more and more on that side. So constitutional medicine is helping the patient to allow medicine to work quickly.
Okay.
So once you select, so constitutional medicine will help to develop a sort of acceptance, and then you can give the local acting medicine. So that will make a magic, that will make a miracle.
Okay, thank you, sir.
Okay,
Your
thank
class
you.
is
Thank you.
very nice and informative. Sir, please come again and give another class in another subject. Okay,
If
thank you very much.
if,
Good night.
if Dr. Danesh permits me, then I will come again. He is the boss.
Okay,
No, sir. You are the boss. I am just
No.
a coordinator of all these things because our guests are supposed to be the boss in this forum. What we
Dr. Ganesh is inviting, then definitely. I never say no to him. I never say no to him.
Definitely, sir. We are planning to have another session in December, if possible, sir. Otherwise, in January, as per your convenience, because
Okay,
we want such presentation in this forum every day. So we are continuing almost all days until December. It's always filled now, and we hope we can have wonderful session from tomorrow. Also, we have a presentation from a doctor at Rajkot Homeopathic Medical College, Dr. Meghani, who is talking about the.
he was my junior.
Yes, sir. He is also
He was
coming.
my junior.
So, lot of doctors from this Rajkot Medical College is now coming
Taken
out.
by the Parul University.
Yes, sir. Paul University. Sir was also there. Anyway, with that, we come to the end of the session, and tomorrow we will have another session at the same time. It is over to Dr. Mariamma John to moderate the Malayalam session. Thank you all.
Thank